And further afield, Israeli authorities have deregistered Doctors Without Borders and have ordered that they cease operations in Gaza and the West Bank by the 1st of March. The decision comes amid a catastrophic situation in Palestine, where a massive scale-up of humanitarian assistance is urgently needed. The consequences are already evident, with MSF being unable to bring in international staff or critical medical supplies. MSF is calling for support in ensuring international law is observed in these territories, including the facilitation of immediate and effective humanitarian assistance at scale. The director of the Operational Support Unit at MSF Southern Africa, Waterhouse, joins us now in studio. Claire, a very good evening to you. Thanks for joining us and a warm welcome.
Good evening. Thanks for having us.
I mean, the situation has reached a boiling point, if I were to put it that way. But from an operational standpoint, what does deregistration mean on the ground? Does it mean that hospitals will cease to operate, or hospitals and clinics closing and patients being turned away?
Well, at this stage, it's quite difficult to tell, but we have fully had our registration withdrawn by Israeli authorities. We do still have registration that's completely legal and valid under the Palestinian Authority. So we are determined to stay as long as possible under that registration in Gaza and the West Bank, because people need us and we simply cannot give up. But it is possible that if things get pushed further and further, we might start to see those even more catastrophic results from this. But the situation is already completely catastrophic anyway, so it's difficult to imagine how it can get worse, even though we know that that can happen.
Yeah, I'm quite curious to know, I mean, when you say the situation, if the situation will be pushed further and further, I mean, with international staff requested to leave, can the Palestinian colleagues, working on the ground, continue delivering care under MSF?
So almost 100 of our international staff were forced to leave. The last of them left the occupied Palestinian territories yesterday, which is why we are now able to speak about this. But 95% of our staff in Palestine are locally hired staff, and therefore, they are there. They are determined to continue on this work, and we are determined to continue to support them to do that. But of course, they've been through a lot of trauma, a lot of personal sacrifice, and there are a lot of inherent risks to them staying and continuing to do this work while our support is less visible because we have been asked to be removed. So it's a very tricky situation, and we're very worried about the consequences on our staff, but also on our patients who desperately need this.
And MSF has repeatedly warned of catastrophic conditions in Gaza. I mean, what does catastrophic mean in clinical terms and in terms of, malnutrition rates or even preventable deaths?
If you can imagine a need, a severe need, it exists in Gaza at this point. 80% of all shelter is gone. People are not able to access clean water. It's being heavily restricted or even denied by Israeli authorities. We are facing extreme shortages of medical supplies coming in. I mean, things like painkillers and anesthetic. Why would anyone deny those things to people who need them in the current situation? People are not able to access adequate food. They are living in terrible conditions with no dignity. We are seeing just thousands and thousands and thousands of people who need help, who need humanitarian assistance, and instead Gaza is slowly being strangled to death by these restrictions, which are really just a pretext to prevent assistance coming to Palestinians, which will ultimately cost many lives.
Right. Now, Claire, if well-established organizations like MSF are being forced out, who then fills that vacuum? Is there, a credible alternative capacity on the ground to meet the scale of need?
Unfortunately not, and this is a really concerning question to us at the moment. Like I said, we are going to stay as long as humanly possible, and we will do everything we can to stay. But if it comes to that, we are extremely concerned, because there's no organization as big as us who can fill the large-scale work that we've been doing. But also increasingly, we are seeing private security contractors and for-profit companies coming in, and we've already seen that that is a recipe for disaster. It risks militarizing aid, it risks selective aid, it risks, aid for favors and those kinds of things, because these organizations are not established. They don't have the experience that we and other NGOs have. They don't act on a certain specific set of principles or international humanitarian law. It will cost lives as well. It's an extremely dangerous situation.
What could possibly get worse? Are we looking at a spike in mortality or the collapse of primary healthcare systems?
To be honest, we already are seeing those things. The mortality is very high. People are under attack every day. You know, there is a supposed ceasefire in Gaza at the moment. That's very difficult for us to believe on the ground when we see these constant attacks still happening, people still coming to us with terrible wounds. But yes, I think that we can expect mortality to increase. You know, mother and child healthcare, babies being born in these situations where there's not adequate staff or infection prevention control measures in place, malnutrition, very high, communicable diseases. Without access to clean water, there's such a high risk of people catching these diseases, passing them on. You know, we have been working as MSF since 1988 in Palestine and for much longer in the world, and this is still one of the most severe crises that we've ever seen in humanitarian terms. People will continue to die, and the sheer disregard for what is happening in the world. We are urgently calling on other governments, Arab countries, European member states, please step in, say something. It is unacceptable to be refusing humanitarian assistance to people who have already been put through so much.
And considering such a volatility, what has the response been from these international bodies and diplomatic actors?
We simply have not seen enough of a response at all at this stage. And instead what we're seeing is a systematic, coordinated global campaign by Israeli authorities spreading disinformation about us as MSF. You know, we've seen them go as far as paid Google ads, paid promotions, spreading things that are absolutely not true about what MSF is doing in Gaza and the West Bank. And that is a huge security risk to our staff, to our patients, to everyone. And no one is saying anything about any of this. And
just on that point, I mean, earlier on you touched on the fact that MSF is now calling for, you know, international law to be observed. In your view, what are some of the, you know, specific legal obligations that are currently not being upheld?
Well, under international humanitarian law, Israel as an occupying power is obliged, they are obligated legally to allow humanitarian assistance and to support it. What they're doing instead is putting it in a chokehold. Since the 1st of January, we have not been able to bring in new international staff, we've not been able to bring in supplies, and even before that, there was such heavy restrictions on it. You know, there were things like I said, anesthetic, painkillers, gauze and bandages, even things like chlorine and hand sanitizer, which are referred to as dual-use items because I suppose they could be abused. But how else can we run hospitals without keeping them clean, without those kinds of things? And then risks of infection skyrocket, you know. So these are critical items that we need that have been denied to us for so long. The system is failing at this stage, and it is essential that Palestinians start to receive humanitarian assistance. Otherwise, I don't even want to imagine what will come next.
But then with the recent developments, are you seeing or are you observing you know, a dangerous normalization of the obstruction of humanitarian work?
I would say so. You know, these trends, what is happening now is precedents are being set. Yeah. And if global leaders are not going to be calling this behavior out, who's to say that it's not going to happen in other countries? You know, we are active in just about every single conflict zone in the world. Whenever there's a natural disaster, we are the first ones there. Whenever there's an epidemic or a pandemic, we are the first ones there. And now, if we cannot even rely on the countries that we work in to keep us safe, to not spread these unsubstantiated rumors about us, to enable our equipment in, where do we go from there? Is it all going to be for profit, where people can pick and choose who gets aid and who's allowed to live? These things cannot be, if we don't fight them now, the precedent will settle. And exactly as you say, there's a normalization of what's happening. I think people hear that there's a ceasefire in Gaza and they think, okay, the problem's over. But we're here to say the problem is so far from over, and there needs to be an urgent, massive scale up of humanitarian aid if we don't want to see just thousands more, possibly more than thousands more lives lost.
But then, having said that, will you continue engaging the Israeli authorities, and under what conditions would you likely see, you know, a return to full capacity?
It's a difficult question to answer, but we are absolutely still open to dialogue with the Israeli authorities. We've been in negotiations about this issue for almost a year now, and unfortunately we couldn't reach an agreement because we were not willing to compromise on our principles of neutrality and impartiality, and more importantly, protecting our staff and our patients. And those things were up for question in these negotiations. So we absolutely remain open for dialogue. It is critical that we remain, and we will do everything within our possibilities, which includes now speaking out very publicly about this, because it's critical that the world knows what's happening.
Absolutely.
And they know that we have no desire to leave our patients. The only thing that any MSF person in this world cares about is our patients. So when we have to leave them behind, it's nothing short of devastating.
Absolutely. Claire, great chatting to you. Thank you so much for joining us.
Thank you so much.
All right, Claire Waterhouse there. She's the Director of the Operational Support Unit at MSF Southern Africa, sharing her insights as Israeli authorities have ordered MSF to cease operations in Gaza and the West Bank by the 1st of March. You know, a decision unfolding against what the MSF describes as catastrophic humanitarian conditions in Palestine. We'll leave it there for now. We'll be back at the top of the hour. This is the Late Edition.